Hey guys! Welcome to Medicine Made Easy. I wanted to create stuff to help people in general practice. I will be making a series of videos which will be of immense help in general practice and on how to approach to a medical problem. As a part of the video, let's all study about how to approach a patient with fever. In this topic, let's discuss about normal temperature and types of fever. Temperature is a measure of how hot an object is and is commonly measured in Celsius, degree C. Temperature may also be measured in Fahrenheit, degree F, or Kelvin, K. The mean oral temperature is 36.6 degrees Celsius, 95% confidence interval, 35.7 to 37.3 degrees Celsius. Evening temperatures are 1 degree Fahrenheit higher compared to morning temperatures. A temperature of greater than 37.7 degrees Celsius, greater than 99.9 degrees Fahrenheit, which represents the 99th percentile for healthy individuals, defines a fever. The principal thermoregulatory area is located within the brain in the preoptic area and anterior hypothalamus. This image depicts heat loss and heat gain mechanisms in the body. Causes of abnormal heat gain. 1. Excessive metabolic processes. A. Drugs. 2. Preventing heat loss mostly through preventing of sweating. Hot environment. High humidity and C. Inhibiting sweating, drugs. Normal heat gain occurs due to metabolic processes. Exercise. Shivering and vasoconstriction. Normal heat loss is through sweating, breathing, vasodilation and cold environment. In the left upper is the image of glass thermometer. For many years, glass thermometers having mercury were the most common type of thermometer used to measure body temperature. This type of thermometer is reasonably right for most clinical purposes. Although they are still available, use of mercury-containing thermometers has diminished greatly because of environmental concerns about mercury exposure from broken or discarded thermometers. These thermometers have been replaced largely by digital thermometers or glass thermometers having liquids other than mercury. Digital thermometers previously were used primarily in the hospital and office setting. As their cost has decreased, they are used more often in the home as well. Electronic thermometers have the advantage over mercury thermometers of requiring a significantly shorter dwell time, that is, the time they must remain in situ to obtain an accurate reading. Hospital-grade electronic thermometers typically have two modes, monitor and predictive. In the monitor mode, these thermometers function similarly to mercury thermometers in that they must remain in place until equilibration occurs, a process that may require several minutes. In the predictive mode, a complex algorithm is used to estimate the final temperature based on measurements made during the first few seconds. Infrared thermometers are a more recent addition to the clinician's armamentarium. Devices that determine the temperature by detecting infrared radiation emitted from the eardrum are used most frequently. Tympanic temperature usually provide an accurate estimation of the core temperature because its blood supply is derived from the carotid artery. Additional advantages of this type of thermometer are its speed, acceptance by patients, and decreased risk of cross-contamination compared with oral or rectal thermometers. More recently, the temporal artery thermometer is being used. These thermometers use an infrared sensor to determine skin temperature as the device is passed across the forehead and temporal area. Depending on the site of measurement, body temperature may vary by 1 degree Celsius or more. Most common locations for measuring body temperature are the mouth, rectum, axilla, and tympanic membrane. When taking a temperature orally, one should place the thermometer in the sublingual space because the blood supply for structures in this region is derived from branches of the carotid arteries and should reflect the core temperature accurately. Younger children usually are unable to cooperate adequately to permit the use of oral thermometers. In addition, the oral temperature may be affected by recent ingestion of hot or cold liquids, and it may be altered by tachypnea. Rectal temperatures are used frequently in younger children. The rectal temperature correlates well with the core body temperature. The rectal temperature may exceed the core temperature, using the pulmonary artery temperature as the reference standard, however, possibly because of the effects of bacterial activity in the rectum. The use of rectal thermometry has the disadvantage of causing the patient discomfort and is contraindicated in patients with neutropenia because of the risks of causing invasive infection via trauma to the rectal mucosa. Axillary temperatures are appealing because of the ready accessibility of the axillae. Considerable variability occurs in the readings obtained, however, particularly in younger children. One should not rely on axillary temperatures, particularly in neonates and young children. This picture gives overview of pros and cons of various methods for detecting temperatures. Next comes the topic: types of fevers and causes. Sustained/continuous, persistent rise in temperature with minimal, less than 1 degree Celsius, diurnal variation. Causes: pneumonia, meningitis, urinary tract infection, and brucella. Step-ladder fever, a type of sustained fever where the temperature rises gradually to a higher level with each spike. Causes: typhoid and typhus. Intermittent, exaggeration of the normal circadian rhythm. If the variation between high and low is extremely large, it is called hectic. Causes: deep-seated infection, abscesses, Kala-Azar, malignancy, drug fever. Remittent, temperature spikes fall daily with diurnal variation of greater than 2 degrees Celsius, but don't go down to normal. Causes: tuberculosis, infective endocarditis, many viral and bacterial infections. Relapsing, febrile episodes are separated by intervals of normal temperature. Causes: malaria, Borrelia, relapsing fever, tuberculosis, and lymphoma. If this occurs daily, it is called quotidian fever. Causes: Plasmodium falciparum. A double quotidian fever occurs when there are 2 spikes of fever every day, generally once in the morning and once in the evening. Causes: miliary tuberculosis. If it occurs every 48 hours, it is called tertian fever. Causes: Plasmodium falciparum, Plasmodium vivax. Plasmodium ovale. If it occurs every 72 hours, it is called quartan fever. Causes: Plasmodium malariae. Inverse fever, the temperature rises in the early hours of morning rather than in the evening. Causes: some cases of miliary tuberculosis. Night sweats. In some diseases, the rise in body temperature is evident only in the evening or late at night when the patient is woken up sweating. This pattern is seen when the mild rise in temperature is added to the normal diurnal evening rise, leading to the body temperature rising beyond the normal level. Causes: tuberculosis, leukemia, lymphoma, autoimmune disorders. Temperature pulse disparity. This is the counterintuitive response of a slower pulse associated with a high fever, commonly associated with typhoid fever. Thanks for watching. Next topic is approach to fever step by step. Please do subscribe my channel to receive more information on upcoming videos.